You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, a hot topic, a new laser treatment for people that are suffering with gum disease. With us, we have an expert on the topic, board-certified periodontist, Dr. Scharff. Dr. Scharff, welcome, I should say, back to the show. We've had you on before.
Thanks, Randy.
Now, before we get into the topic, this new laser that treats gum disease, tell me a little bit about your practice for people that don't know you.
Well, I'm a periodontist, board-certified periodontist, and I practice in beautiful Babylon Village, right on the south shore of Long Island.
Okay.
I've been in that location about 13, 14 years, and I was a couple miles west about 5 years before that. And the focus of my practice as a periodontist is really twofold. First, we help people regain their confidence, regain their smile by placing dental implants. That can be someone that's lost their teeth and has loose dentures, or someone that needs a whole new set of teeth. And another big part of my practice is treating periodontal disease. And you know, periodontal disease is really the #1 cause of tooth loss in adults. And we can do everything from cover recession when people have long-looking teeth, to treat gum disease, regrow bone around teeth.
A lot has changed, though, you say.
Oh, tremendous.
I mean, now it's a fun for you to take care of it. Whereas, expand on that. What do you mean by that?
You know, the treatment of periodontal disease has really changed dramatically in the 20 or so years that I've been a periodontist. When I finished my perio training, advanced periodontal disease was always treated with cut and stitch gum surgery. And people would do it because they wanted to keep their teeth, but nobody enjoyed doing it. No one thanked me for doing it when we were done.
Right.
And it was, although technically it was enjoyable to do, that's why a lot of people become periodontists, it's hard to enjoy doing it when you know that people weren't enjoying having it.
Okay, okay. So now this new laser has changed all that. I mean, is it really that different?
It's completely different
than the way it was before?
It's completely different. You know, before, when someone came in with advanced disease, they'd have a number of visits with a hygienist of scaling, 3 or 4 visits, and then they would have a number of visits of gum surgery, where we lift the gum up from around the teeth. I'll show you in a little bit. I brought some pictures to show you. And now with the laser, we can reverse 20 years of neglect sometimes, or 20 years of disease in a couple 2-hour sessions.
So things like no more bleeding gums, no more loose teeth, no more bad breath. These are, I mean, are these truths about what this laser can do?
Yeah, this,
I mean, not an exaggeration?
Not an exaggeration at all. This laser I found to be as effective or more effective at treating periodontal disease than was the old cut and stitch surgery.
Now, we should talk about your background in training. You're board certified periodontist. You're clinical professor, assistant clinical professor at New York University College of Dentistry?
Yes.
So who do you teach there? What's your topic?
Well, I teach treating periodontal disease and dental implants to people who are already dentists and are training to be specialists in those fields.
Okay, let's talk about, first of all, define periodontal disease. Is it gum disease, periodontal disease? Are they the same thing?
Well, they're 2 different words for the same thing. Dentists would call it periodontal disease, and most people call it gum disease or pyorrhea, and they're really 2 diseases that make up the family of gum diseases. The first one is gingivitis, which typically people would know as bleeding gums, and that's just limited to the gum tissue. And then if gingivitis is left untreated, many times it progresses deeper to the bone, and that disease is called periodontitis, or years ago it was called pyorrhea. And the end result of untreated periodontitis many times is tooth loss.
Okay, so gum, now when you're flossing and your gums bleed, that's gum disease?
Yeah, that's gingivitis. Your gum should never bleed. You know,
really?
If you brushed your hair and your scalp started to bleed, or you washed your hands and your fingers started to bleed.
Is that a fair comparison, though? Really? I mean, gums really aren't supposed to bleed at all?
Gums should never bleed. When people's gums are healthy,
right?
And what I always find interesting is many people, once we treat their gum disease, their gums don't bleed anymore, and they'll say, "My gums have been bleeding for 30 years. I can't believe. I just thought it was normal because they always bled. And now when they bleed, I know I have a problem. There's trouble." So healthy gums should never bleed, and it should never really be accepted as normal. It's not normal at all.
So if someone doesn't have bleeding gums, they're fine?
You know, not necessarily, for a couple of reasons. First, smokers almost never have bleeding gums, and smoking is one of the few things that greatly accelerates gum disease. In fact, it's very rare to have a smoker that doesn't have gum disease, and almost without exception, smokers don't have bleeding gums. The other thing is, once the gum disease has become very advanced, Randy, many times the gums stop bleeding because the problem is so deep into the gum, into the bone, that the gums aren't bleeding anymore. And I have a model really that'll show that to you.
Okay.
So when you look at this model from the outside, both sides look the same, and you wouldn't know that anything's wrong underneath. Let's look at this one side. When we lift up the gum, you can see the bone underneath, and this bone is normal. When you look at the other side, again, from the outside, you can't see. The gum's like a curtain. It's like a stage. You can't see what's happening behind it. But when you lift up the gum, this side of the model shows bone loss. So
those roots are exposed. That's what I'm looking at.
those roots are exposed, they're not in the bone as much. There's not as much bone around them. And as that happens more and more, eventually the teeth become loose and can fall out. And that's how somebody can have perfectly normal looking gums that don't bleed, that don't hurt, that the teeth aren't shifting, and yet had very advanced disease.
So see your dentist and see if you have that going on.
When you go to the dentist,
because you may not have bleeding gums.
You may not have bleeding gums at all, but when you go to the dentist, they measure how deep those pockets are. 2 to 3 millimeters is normal. Deeper than that is where bone loss is starting.
Okay, so the laser takes care of that, wipes that out. And I have questions about the mechanism, how that works. But what are other symptoms?
Some of the symptoms of gum disease, again, are red, puffy, bleeding gums, tender gums. Bad breath is a common one when people have periodontal disease. As periodontal disease becomes more advanced, sometimes the teeth start to shift, so people get spaces between their teeth. The teeth start to flare out. If you ever see an adult who has sort of buck teeth or flared teeth,
interesting,
that didn't have that when they were younger, it's because the bone support on the teeth is being reduced, and now the teeth are starting to move.
So you see teeth that are kind of moving forward. I've seen that.
Yeah,
and that's really because they're losing bone?
The bone is what holds the teeth in, and then as the bone is lost, the teeth become weaker, and they start to shift, they start to move, they start to get loose. And I've had people who wake up with a tooth on their pillow, and that's the first time that they say, geez, I think I might have a problem with my gums.
Okay, so this laser, what, just goes in and just kills the bacteria?
That's one of the...
Is that what's happening?
That's how, part of how it gets rid of the gum disease. Yeah, what happens is the laser energy first goes into the pocket, and it removes diseased tissue but leaves healthy tissue untouched. If I were to take the laser and move it over a piece of newsprint, it doesn't affect the paper at all, but it will remove the ink from the newsprint, leaving the paper undisturbed. So the bacteria of periodontal disease soak up light energy very well. So the laser goes in, it kills those bacteria, and it removes the diseased tissue very selectively and doesn't touch healthy tissue at all. It's more precise than any surgeon's scalpel could ever be.
Okay, so the way it's been done, or being done nationwide, okay, is you go in, you cut it out. I mean, is that right? Or scrape it out?
In effect, what we would do is we would make an incision and lift the gum up from around the teeth. Once the gum is reflected, we could see the root of the tooth, and we would scrape the tartar off the root in a hope to remove the tartar, to remove the bacteria. And then we would put the gum back. So it was sort of removing it mechanically. But in order to remove it mechanically, it was very invasive. We'd have to open the gum and ultimately close the gum. And the act of cutting open the gum, reshaping the bone
painful?
sometimes.
Very painful?
Well, not painful during the treatment.
But after the treatment, I mean, there's some downtime, eating?
It certainly can be.
And that's the old way. We're talking about the old way.
Right.
But the old way is being done every day.
Right.
And right? Is that right? Even in Long Island?
It's being done everywhere. And what's interesting is people always have a quandary. Nobody wants to lose their teeth. No one comes in and says, well, I'm okay losing my teeth. Who would want to go to work, see their spouse, meet their friends, and have half their teeth missing? Nobody.
Okay.
But people would be so hesitant to do periodontal surgery because they've heard horror stories from their friend or from their spouse that many people really make a conscious or unconscious decision to leave their gum disease untreated because they felt it would be, they'd rather lose their teeth than have that surgery done.
Okay, but that all has changed, I guess, because of this laser.
It's changed
Are
dramatically.
you the only person, I understand, in Long Island with this laser?
I'm the first periodontist on Long Island that has the laser, yeah.
And what's the downtime, by the way? Okay, so you have this laser treatment for the bleeding gums, bad breath, loose teeth, all those things. How soon can they be somewhat comfortable with their eating, chewing, things like that?
Well, they're comfortable right away. There's no, 2 days ago I treated a gentleman in the morning and he went to work in the afternoon. So people take a Motrin or a Tylenol after treatment. They don't have the weeks and weeks of downtime or the longer downtime that cut and stitch surgery would have.
Are people traveling a long way to see you? Because you're the only guy that has the laser right?
I'm amazed. People are coming from Montauk all the way on the East End, from New York City and everywhere in between, passing 30, 40 periodontists in between. And it sort of gets to my point that everybody wants to keep their teeth. Who in their right mind would make a conscious decision to lose their teeth? But if it means going through having periodontal surgery, a lot of people just don't want to do that. So it's sort of a way that you can have your cake and eat it too. You can treat your gum disease without having to have surgery.
Now, you say there's a lot of people that it affects their self-esteem, having this gum disease. Tell me more about that.
Well, when people have gum disease, a number of things happen. First, their breath isn't so fresh anymore. And it can be a subtle thing. Maybe their spouse tells them, go back in the bathroom, brush your teeth. But as we said, as much as you brush your teeth, you can't get rid of the bad breath many times. So what happens? You don't want to be in a social situation. You withdraw. Maybe you're on a job interview and you're sitting across the desk wondering if the person, can smell your breath.
Wow.
As the disease...
So they tell you this on consults?
Oh yeah, when I ask them, what can I do for you, or what are your problems, what can I do to help you, they'll say, oh, my breath is terrible. No matter what I do, I can't get my breath fresh.
I mean, is it that simple? Am I oversimplifying, I guess, the explanation? I mean, you're kind of zapping it out.
It's really very straightforward.
It's the bacteria. You're killing the bacteria.
The laser
so
does.
All tooth loss is basically from this bacteria that eats away at the...
All tooth loss from periodontal disease is from the bacteria getting under the gum, setting up this process in the bone whereby the bone is destroyed and eventually the teeth are lost.
So the public has two choices, and I'm sorry to interrupt. Scrape it out, cut it out, or get a laser and remove it that way. Is that right? Am I understanding it correctly?
That's right. I mean, the essence is the same. Whether you're treating it with surgery or treating it with the laser, what you have to do is get rid of the diseased tissue, get rid of the bacteria, get rid of the tartar, and make the pocket shallow. So when you do cut and stitch gum surgery, we're opening the gum, we're scraping out the bacteria and the tartar, and we're putting the gum back many times higher up on the root, so there's more root exposed, but the pocket is shallow. The laser is doing the same thing in a different way. The laser energy is killing the bacteria, it loosens the tartar from the teeth so we can remove that, and then you go back in with the laser on another setting, and the laser, in effect, heats the blood and connects the gum back to the root of the tooth. So after you treat someone with the laser, you don't have all the recession that you have typically after conventional periodontal surgery. You don't have the cold sensitivity. And those are the things people always complained about long term.
So with the old, one of the drawbacks with that root planing or that scraping and cutting procedure is they may end up with cold sensitivity.
Exactly.
So why does a laser that doesn't happen so much?
Because after traditional periodontal surgery, there's a fair amount of recession of the gum. So either we intentionally move the gum up, or because we've reflected the gum from the bone, exposed the root, taken away some diseased tissue, there's more root exposed. With the laser, we're not lifting the gum off the bone. We're not cutting away, big pieces of diseased tissue.
So the root is sensitive.
The root's very sensitive.
So if you have cold sensitivity, meaning fluids are leaking into that direct root, you have a problem.
Yeah, it's very sensitive.
Interesting.
Many people, won't eat ice cream, won't have cold drinks, and they suffer with it again because they wanted to keep their teeth. But
because the gums have
reconnected to the tooth.
Okay. And if it's cold, I'm sorry, if you have cold sensitivity, the gums have kind of moved away from the
root. Gums have receded. They've moved up, or they've exposed some of the root, so that now it's more sensitive. But that can be
stopped. I mean, it's simple. I mean, it's just early treatment. Is that the key? I mean, if you see bleeding gums, go in.
Right. Most people, because they think bleeding gums is normal, ignore bleeding gums. And then it festers until eventually people have bone loss around the teeth. And then either they realize they have a problem or they go to their dentist who tells them they have a problem. And by that point, they have bone loss around the teeth, they have deep pockets, and that whole cycle of destruction has started. We're
going to take a quick break. You brought these photos.
Yeah.
And some are very graphic. So I should say if you're squeamish, you don't want to watch this next segment. But the afters are fantastic. I mean, cleaning up their mouths with what? How many treatments, by the way? Like 1 or 2 treatments?
That's the beauty of it. With conventional periodontal surgery or that type of therapy, sometimes it would be 6, 8, 10 treatments. With the laser, at most, usually it's 2 treatments. So you can reverse, 20 years, 30 years of periodontal disease in 2 visits, and people are on their way again.
Okay, and by the way, you mentioned something. I didn't know this was a big, puffy, pink gums or red gums. The laser would take care of that as well.
Right, the laser would...
And reduce that inflammation?
The laser would take care of that inflammation. The laser, coupled with proper cleaning of the teeth, proper oral hygiene at home, restores health to the gum, sure.
Okay, we're going to take a quick break. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, before and after photos that are very, very dramatic. We'll be right back.
This is the video animation of the FDA-cleared periodontal procedure called LANAP, an acronym for Laser-Assisted New Attachment Procedure. The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with gum disease. With us we have Dr. Scharff, a board-certified periodontist. Okay, you brought some photos.
I brought some pictures I wanted to show you. This is a woman who's going to have conventional periodontal surgery, and she had deep periodontal disease on these teeth, didn't want to lose those teeth. Now,
Wow, what's going on there?
well, the first part of periodontal surgery is that you lift the gum up from the tooth, exposing the whole root of the tooth and the bone.
Okay, so that picture right there, I'm looking at. Did you cut away the gum, or it's being lifted up?
It's being lifted up like you could lift up a window shade. It's reflected from the tooth. After it's lifted out, we scrape out all the diseased tissue. We scrape the tartar off the root of the teeth. And then here's the last picture of the gum being stitched back in place.
Okay, so this is the standard treatment
Right.
of gum disease.
Yes. And you may say again, boy, why would anybody do that? But again, it gets back to nobody wants to lose their teeth. I mean, could you imagine, going for a job interview and having to smile and not having teeth, or going out with your friends and being conscious of your breath? The teeth affect people in a tremendous way. It's so core to our appearance. When you look in the mirror, when your friends see you, what does a nice smile say? When you see somebody with a nice
happy.
smile,
They're positive.
They're happy, they're positive people, they're good looking.
Healthy too.
Yeah, and what do people equate with dentures in the glass? My grandparents, being old, everyone's biggest fear is being in the nursing home and having to take their teeth out, losing their teeth. So again, people would go through this because who wants those consequences? Who wants to lose their teeth? Yeah, so people would go through that, but who would want to lose their teeth?
Those are stitches.
Those are the stitches that hold the gum back, and then after a week or 2 weeks, the gum knits together back with the root of the tooth and back with the bone. So there's more root exposed many times, there's some recession, but the pockets are shallow and it's cleaned out.
So the surgery, and we'll call it the old surgery that's being done every day, is you're scraping it out, you pull the gums up, you scrape out the diseased tissue, right? And then you wait for it to heal back. Okay, so now you have the laser.
Right.
So the laser comes in.
So here's an example. Here's a picture of someone before we treated their disease. And the gums are puffy, they're red, they're swollen.
Wow.
And this is a person that hadn't been to the dentist in years and years and years. And as happens many times, they know they have a problem, they're afraid of what the solution to that problem is going to be, so they stay away, and the problem only gets worse.
Other than the obvious, which is, I guess, very strange looking teeth and gums, what else is going on there?
Well, what you can't tell from the picture is that that person has bad breath, that every time they chew, that their gums start to bleed. So sometimes they go out to eat with a friend, they're eating whatever they're eating, and their gums will start to bleed. They'll dab their gums on a napkin. Sometimes the teeth get loose, there's so much bone loss, and then people can't chew the foods that they want to chew. So this person, Randy, has bleeding gums. They'll go out to eat or they'll brush their teeth and the gums will bleed. Imagine going out to eat, having something crunchy like a cracker, or eating an apple and looking in the apple and having blood be in the apple.
Really?
That's what this person had. Bad breath, the teeth start to get loose. So you can see, and if you look here at the bottom of the picture, you can see that the root is starting to be exposed. So when someone has part of the root exposed, the only way that's going to happen is if they've lost bone around the teeth already. So sometimes people have recession on the teeth and they think, well, that's normal, I just have a little recession. There's no way to have recession unless there's been bone loss around the teeth.
So when you see recession, gums receding, they're losing bone.
That means there's been bone loss around the teeth.
From this bacteria? Am I calling it right?
From the bacteria. And the thing is that this many times can be treated. We can treat it with the laser. But if it's not treated, it ends up resulting many times in the loss of those teeth.
So in this case, what do you do?
Well, so in this case, we treated this person with the laser. Let me show you this picture. Now this is right after the laser treatment was done. And you can see there's no stitches in place. The whole area isn't all disrupted because, again, the laser is very, very selective in what it does. So it goes in, it kills the bacteria, we remove the tartar, it seals the gum back around the tooth, all with no discomfort. The person's numb, and afterwards, again, just a Motrin or a Tylenol is all they need. And now let's fast forward 2 weeks down the road. Look at the change in the gums that this person has.
Yeah. So it's gone.
Yeah.
That diseased tissue, for the most part, I mean, you got most of it, is gone.
it's gone. Because the bacteria has been removed, the body can take over. You know, to me, this is a very holistic treatment almost, because really what are we doing? We're removing the bacteria that's causing the problem and then letting the body's own systems take over to reconnect the gum back to the tooth and restore
health. So no more
health.
bleeding gums in this case?
No more
Better
bleeding
breath?
gums, no more bad breath. And the beauty of it is it happens so quickly. It's not weeks and weeks of visits. It's not multiple visits. It's a couple of visits and people are treated.
Well, logically, it definitely makes sense. And I'm not trying to side with you too much, you know, on this. And people need to know that, you know, this is a real interview. Nobody's reading scripts. We didn't rehearse this. But it seems like that if anybody has this problem, they should go in and get it done by a laser. Period. I mean, is that your thoughts?
Well, that was the conclusion I came to as well, and that's why I got involved with the laser.
So, as of today's day, you're the only periodontist in Long Island that has one of these lasers.
That's right, and it's really been a revolution to my practice for a few reasons. First, I've always tried very hard not to do periodontal surgery because for myself I wouldn't want it if I needed it. So we would do scaling. Anything non-surgical that seemed like it worked, I would investigate and try to use to the extent possible. And I think over the years patients really appreciated coming to my practice because I wasn't very quick to take out the scalpel and to do gum surgery. But the flip side is that if you don't treat gum disease sufficiently, it's not enough. Some people would say, well, I don't want the surgery, I just want scaling. Just scale my teeth and don't do anything else. And you would.
Do they tell you that?
Some people would, and you have to respect them. That's what they're choosing. But they would have a false sense of security because they were treating their disease insufficiently. And if you treat it insufficiently, ultimately it's going to fail. They're going to lose their teeth anyway. So to me, the beauty of the laser is that they could have their cake and eat it too. We could treat it, we can get rid of the pockets, we can regrow some of the bone they've lost around the teeth without them having to go through surgery and all that that entails. And I think people really appreciate that. And the proof is in the pudding because so many patients come from other patients who've been treated this way. Everybody talks, and I see the results every day, both in terms of patients coming back after treatment saying, wow, that was a breeze, I'm so glad that I did
So
this.
pain is not something they complain about, really?
They don't. In fact, I've had a number of patients, Randy, who had conventional periodontal surgery years ago. They broke down again, they needed periodontal treatment again. So these people are the perfect controlled experiment. They've had conventional cut and stitch periodontal surgery and they've had laser treatment. And without exception, they say, that laser was a breeze, I would never do that other kind of surgery again. This was simple, and it is simple. You're anesthetized, you sit, you have it done, and afterwards there's really very little downtime.
So how soon before they see results after the treatment?
The results are almost immediate. People come back a week later and already they're saying, boy, my gums don't bleed anymore, my mouth feels great, and the effect on their body is immediate as well. I'm going to tell you two fast stories.
Okay.
As a lot of people probably know, gum disease affects diabetes. So people who are diabetic, number one, are more at risk for severe gum disease. And diabetics who have severe gum disease, their need for insulin or diabetic medications is higher because gum disease is a chronic infection, and chronic infections drives up someone's blood sugar. I had a patient a few months ago who was on an insulin pump, and he had tremendous periodontal disease, hadn't been to the dentist in 20 years. I treated his dad, and his dad referred him to my practice, and he used to have to put a new vial of insulin in his insulin pump every 3 days. We did his laser treatment, and he was in last week for a quick check, and I said, just out of curiosity, are you using less insulin? He says, you know, a vial of insulin lasts me 5 days now. Think about how his overall health has improved because he's treated his periodontal disease. It's really fantastic. And the other thing we see sometimes is, you know, when people have tremendous gum disease, you know, it's a chronic inflammation in the body.
So it is a chronic infection? You called it an infection. Is that what it is?
You know, when people think of infection, they think of, you know, a big abscess or something, a toothache type thing. It's really a chronic inflammation, and the body is constantly mounting this immune response to try and get rid of the bacteria, but it can't get rid of the bacteria. So if you ever had the flu, you know that when you're sick, your body's fighting this massive war against what's invading your body. You have no energy at all.
Good point.
So many people who have severe gum disease, after their disease is treated and their body doesn't have to constantly fight this infection, they just feel like they have more energy.
Wow.
I've never
well,
read
makes sense.
I've never read a study on it, but I've had so many people tell me, I just feel better, I have more energy. And you know, sometimes I think some of that is also because of how they feel about themselves. They don't have the worry. Most people who have this problem worry about it, worry about what's going to happen if they don't treat it.
Wow.
So that's constantly on their mind. Their breath is always on their mind. It's like that worry is just cleared off their plate and they can go on with things. They can smile, they can eat, not bleed. They don't feel bad every day when they brush their teeth and they spit into the sink and they see blood. And I think part of their feeling better and having more energy, aside from the biologic part, is just the psychological part of, boy, that's done. I don't have to worry about that anymore. I'm going to keep my teeth. I'm going to have a nice smile. I don't have to have dentures in the nursing home. I don't have to limit what I eat. I don't have to be embarrassed kissing my favorite person I like to kiss. They just feel good again.
What about cost comparison between the cutting and stitching and this laser?
You know, that's the beauty of it too, Randy, is that with conventional treatment, you have a number of visits with the hygienist, a lot of surgical visits. It's very time consuming. It's a lot of hours of that patient being in the office. So it can be more. It can be more. Most times, traditional cut and stitch surgery is more expensive than using the laser. You would think this is such a high-tech thing, and it's so much, so fewer side effects, so much faster. It should cost more, but many times it costs less, and it becomes a win-win.
So when do people, by the way, at what age ranges do people start getting this problem, and when should they do something about it?
That's a great question. You know, many people have gingivitis throughout their life, just the inflammation of the gum, and at a certain point it starts to become bone loss. For some people it's in their 20s, for some people it's in their 30s, for some people it's in their 40s. But a lot of times when it's early on, people ignore it. They say, the dentist will say, well, you have early gum disease, or it's just starting. So what does that do? It sort of minimizes it in the person's mind.
So you're in your 30s and your gums are bleeding.
You're in your 30s, your gums are bleeding.
Last thing you're going to do is go to the dentist, I guess.
Right, you think I have a mortgage, I have young kids, I have all this stuff. The last thing I want to do is have, you know, gum surgery.
So talk to them then. What do they need to know? Those 30-year-olds that have these problems.
You can save a whole lot of problems down the road by treating your gum disease early on. If you have bleeding gums, if you have pockets, treat it and resolve it at a younger age. It'll be
so zap it out. Just zap out that bacteria.
Zap it out.
Laser it out.
Laser it out. Treat the gum disease early on, and you'll enjoy your teeth, enjoy fresh breath, enjoy strong teeth, enjoy the vitality that comes with having your teeth, hopefully for the rest of your life.
Okay, good. Well, I want to thank you for coming on. And by the way, if somebody wants, their first move is what? They call your office, make an appointment. How long before they know they're a candidate?
That's a great question. You know, a lot of people just want information on this technology. And for people that just want information, call our office. We can mail you a booklet. We can mail you all sorts of information. Number two, we have a very thorough website just discussing laser periodontal therapy. So you can go to the website and read about it there. If you want to come into the office, there's two ways you can come in. Some people just want to talk. They don't want a whole exam. They just want to have some questions answered, and we have what's called a meet and greet. Call our office, say, I'd like to have a meet and greet with Dr. Scharff.
Is that right? Good for you.
And, you know, we just schedule 5-10 minutes, say hello, show them the office, show them the laser, show them what it's all about. And then if they want to become patients, we can schedule regular appointments. And some people just know they want us to treat their gum disease. They call up and say, I'd like to make a new patient exam. So we call up, we schedule you either for a new patient exam or a meet and greet, and take care of your problem.
All right. Well, thank you for coming on the show. Very, very interesting.
T's for having me.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.